All right. Hello, everybody. Welcome to Safer Use Supplies for Overdose and Infectious Disease Prevention. Just a quick reminder before we jump right into this. In order to receive a certificate of attendance, you have to fill out the survey for each day that you attend. We'll post the survey link at the end of every session. And then once the series ends on October 28th, we'll send you one certificate with the number of hours that you attended. So my name's Justin. I'm the Washington Poison Center's community health educator for Eastern Washington. As such, I get to go all over our state and work with various organizations and communities on poison prevention education. I find the work in rural communities to be especially important, complex, and inspiring. I'm so excited today to welcome Malia Lewis from Blue Mountain Heart to Heart to the Washington Poison Center's 2024 annual Overdose series. Blue Mountain Heart to Heart is a community-based organization whose mission is to promote public health with advocacy, education, harm reduction, clinical services, and support for individuals across the spectrum of chronic conditions, with a special emphasis on HIV prevention and care. They hope to encourage an environment of dignity and improved quality of life for the entirety of the communities they serve. Blue Mountain Heart to Heart has been serving clients and providing prevention education to communities in Southeast Washington since 1991. Today we have Malia Lewis joining us. Malia is a Master of Social Work, a syringe service program manager, and the inaugural drug checking technician serving Eastern Washington. As a drug checking technician, Malia uses a spectrometer to help people know what's in a substance before people use them. This helps prevent accidental overdose and increases awareness of the risks. Malia is a rural harm reductionist and educator. They also serve as a member of the Washington State Safe Supply Work Group. With that, thank you for joining us, and please take it away, Malia.
Hi, everyone. A quick note, we've been here since 1985, and I should have shared that information prior to this opening. Thank you so much for having me. Melissa was unavailable to join us this morning, unfortunately, due to an emergency, but I will be trying my best to answer any questions that come up other than the clinical pieces. So let's talk about supplies. Let's advance. So I wanted to cover a brief history of harm reduction because folks often think of harm reduction as a fairly new tool for keeping people safer and engaging with people who use substances, but it's actually something that has been in the societal discussion since the 1920s. We've had various approaches to attempting harm reduction. The strongest approaches to harm reduction have come out of communities serving one another. So folks in sub-communities who know each other well, caring for one another, and then expanding on that care to create models that sustain our work today, even as we have become more and more medicalized. Today we have in the World Health Organization Technical Guide, there's an international comprehensive harm reduction package, and SSPs are the #1 tool in that package list for promoting harm reduction here.
Sorry, Malia. I'm afraid we don't have sound capability
Oh
with this
no!
meeting right now. I can look into it really briefly,
Oh
but if you
shoot!
want to, thank you.
Well, we will swap back for a moment then. Oh, how do I get back to where I was going? I'm sorry, friends. This worked internally, of course, because that's how that works.
Malia, if you send us the link, we can put it in the chat box for people to watch after the session ends.
Okay, it's in the slides that I shared with y'all. It's linked in the title, and there are 2 different videos there. History links to a video that's very brief and just covers people caring for people and how that connects to harm reduction, and then The second one I think is the more important video if folks are willing to watch. It is a collection of both providers and recipients, and there's a lot of overlap between those two groups in harm reduction communities, talking about what harm reduction means to them and their theoretical orientation as well as personal motivation to provide harm reduction care. So I will move on then. So Melissa definitely put together these slides from the National Harm Reduction Coalition website, talking about the principles of harm reduction because that theoretical orientation is very central to the way that we do our work. One of the primary fundamental pieces of doing harm reduction is accepting that drug use happens, accepting that it's complex, promoting quality of life, health, and well-being, sort of regardless of where you're meeting people in the work, and engaging in non-judgmental and non-coercive ways. Non-coercive can be harder than folks anticipate when they come into this work initially. It's easy to overlook the ways that we kind of build social coercion into maintaining society. Most of y'all have probably heard the phrase, nothing about us without us. It's really important to centralize the folks who are receiving these services in how we create these services so that they are responsive, appropriate, properly scaled services that show up in the places where folks need them, as opposed to isolated in a corner. Why are we not seeing participants in this space? Why are we not able to reach this community, this population that we care so deeply about? Harm reduction really recenters the work where folks are found. And we'll talk a little bit about that later. Part of what we do is empowering autonomy to reduce harm. Everything we do centralizes the autonomy and agency of the folks we're serving. We are not here to direct folks in their way. We're not here to tell folks how to change their lives, treat themselves. We're here to empower. Did I just fall out of the?
Yeah, no, you're back now. So I think you'll want to reshare your screen. It froze for a second, and I think there we go. Excellent.
There we
Thank you
go.
so much.
Yeah, I'm so sorry. I'm not sure where I left off. We were talking about autonomy, reducing harm, recognizing trauma, engaging in a trauma-informed manner, and having an awareness of social inequality and oppression and how those paradigms impact the folks we serve is vital. And recognizing that there is real harm and danger with substance use. Substance use is not an inherently safe behavior, and we don't try to pretend that it is in the process of engaging with folks who are using substances in the work that we do. So one of the ways that we try and address some of that social inequality and trauma in systems contexts is by addressing stigma that shows up in the language that we use daily. There's a lot of stigmatizing language that's kind of baked into common language that's popular today. And this is a list of some of the different phrases or terms that we use to destigmatize the way we talk about what we see on a daily basis. So I'm never going to talk about somebody or a UA as being clean or unclean or whatever. I'm not going to talk about somebody in terms that are disparaging around intoxication. I am not going to talk about people as, I'm not going to demonize protective behaviors or trauma responses. And that doesn't mean that we don't set reasonable, appropriate boundaries and maintain an environment that is safe for the folks doing this work, but it means that we focus that safety on everyone in the space, everyone in the room, that we are collectively improving the community environment as opposed to relying on top-down measures for that sense of safety. Another one on this list that I think Melissa wanted to point out was the difference between talking about medication for opioid use disorder versus opioid replacement therapy, which is a fairly antiquated term for that mechanism of treatment. So the fun part, we came to talk about the anatomy of an SSP today. SSP stands for Syringe Service Program. As we mentioned earlier, Blue Mountain Heart to Heart started out doing HIV related work in this area in 1985, and we opened the syringe exchange aspect of our programming in 1993, I believe. So on the screen, there are a couple of images of different things that we give out in the syringe services program, but I also came prepared for show and tell. So one of the things you see on screen is a tourniquet. One of the things that we address in the syringe services program if folks come in is safer injecting practices. So we are willing and able to sit down with folks and talk to them about what they're doing, what's working, what's not working, and what things they can do to mitigate risk in the process of injection use. I'm digging through my box trying to figure out what where my stuff went. Alcohol prep pads. Every time somebody uses a syringe, we want them to be using an alcohol prep pad so they can have a clean shot every time. We also offer a variety of sizes of syringes, and these are organized from largest to smallest in the sizes that we currently offer at our syringe exchange. We'll talk through vein health. We'll talk through vein mapping. We can talk through what size syringe is most appropriate for a person using intravenously in order to mitigate that tissue damage that occurs anytime you're going to create a hole, right, in your body. One of the very, very basic tenets of syringe exchange harm reduction is never reuse your syringes. We're happy to provide syringes. We're fortunately not operating on a one-to-one exchange ratio currently, so I don't have to get syringes back in order to give somebody clean supplies for use. Along with the syringes, we will give sharps containers in differing sizes depending on the number of syringes provided. The number of syringes provided is based on what folks need to get them through until they can come in next. So sometimes folks don't come in for a month and they'll get several and then they'll bring me back all of them at the end of the month in something bigger like this. Sometimes they need a smaller amount at a time. These hold about 50 and they lock down when folks are done. We also have a smaller option, which is lovely. If I can pop it open. These ones are really neat because they're a little bit easier to stash in a bag if you're living outdoors or have only a bag or two that you can carry all of your things in. And these can hold both unused and used syringes, which is nice. We also provide tourniquets. We want folks to be using clean tourniquets every time. We don't want bloodborne pathogen risk to increase based on shared tourniquets, cookers, cottons, those kinds of supplies. As far as cottons go, I have a couple of different sizes of cottons. We will talk to people about the safety risks inherent to using traditional cotton for filtering drugs. Filtering drugs does improve safety somewhat in injection drug use, but we have an alternative form of cotton that's made of microcrystalline cellulose, which I could hold up to the camera, but it's tiny and y'all won't be able to see it very well, that does not harbor the fungi and bacteria that causes cotton fever. And so they are a much safer option if folks are relying on traditional cotton and or reusing them in the process of injection use. In the center of the screen, there's an image of a bubble pipe, which we also provide currently. The pills and little vial next to it are just for art purposes. We don't give out substances in the SSP, let me be very clear. These bubble pipes that we have currently wrapped, so they're not as likely to pick up environmental dust and dirt. Prior to distribution, this is what the pipe looks like. We have a couple of different shapes of pipe that are used for different substances, and the utility of having different shapes of glass in order to give out in the SSP is to help folks avoid using different substances in the same shape of glass and causing overdose on that basis. So here's a straight piece. We have these stems that come with filters to help reduce some risk there as well. These fit nicely into that stem, and they also come with a couple of other supplies in the container. There's a paper clip. There are mouthpieces that are used to avoid burns and viral transmission from sharing pipes between folks. And all of the stem kits come packaged, thank you, Washington State Department of Health, with condoms to help avoid STI transmission. So we give out a lot of condoms as well. We offer safer sex supplies across a range. We have lubricant that's passed out. We have internal condoms available. I have a lot of supplies all piled together here so that I could show y'all. And I usually have a really nice shelf behind me. So folks walk in to the SSP. They may or may not know what they want, but they've heard that they can get supplies here. They walk in, I'm going to greet them. Hey, I'm really glad you came in today. How can I help you? Just that positive interaction is a big chunk of the substance of the work that we're doing. Being able to connect with people who otherwise might not see a friendly face in a day is huge. Being able to offer non-judgmental space for them to share what's happening for them is huge. Not everything we do is centered around picking up supplies. Sometimes folks will come in just to check in, just to ask a question about other services that might be available in the community that they're not sure about, but they're not really comfortable asking elsewhere in the community because they may be running into stigma based on folks' perception of their substance use. We offer dental dams along with our other safer sex supplies. And we have in the reproductive health section, sorry, we have pregnancy tests and Plan B available. So we will talk people through how to use those. These are dip strips, so they're a little bit different than the ones that you get at the store, but having open and free access to those supplies can be really important for folks. Oops, sorry, I'm scrolling the wrong direction. Naloxone is also on this page. So we have both intramuscular and intranasal preparations of naloxone, which is really useful. We will provide training on how to utilize this medication to reverse overdose to absolutely anybody who walks in at any time. We provide these kits very consistently, both to folks walking into the SSP and in trainings out in the community for institutions locally and for individuals who are concerned and want to have it on deck, just like you would have a fire extinguisher or another harm reduction device. I forgot one of the types of pipes, I'm sorry. These are hammer pipes that we also have available that come with a screen. These screens, again, assist in improving the safety of use within this type of pipe. And folks often relax into the interaction that we're having when we're able to talk through kind of the nitty-gritty about like, oh, you're using this type of pipe, so have you thought about trying this to avoid burns, or have you thought about trying this to feel safer in the process of that use? It comes back over and over again to that non-judgmental, non-coercive openness to engage and connect. We also provide kits for safer snorting at times. These are not always in stock, but somewhat regularly. They have instructions. All of the supplies in here are single use, and there's water in here to offer the opportunity to rinse out the nasal passages and reduce harm from substances sitting in those nasal passages. When we give out those naloxone kits, we're almost always distributing CPR masks, because the most useful thing you can do as an intervention while you're waiting for emergency medical services to arrive in an overdose situation after you've administered naloxone is offering rescue breaths. And these help make folks a little bit more comfortable to offer rescue breaths, especially if they're administering to a stranger. We have a variety of wound care supplies on hand for folks. So this is an extra kit, a special kit that is only accessible in RSSP through a nurse. So folks may come in and say, hey, I've got this thing going on. Can I get some extra bandages? And we'll offer them what we have available, but we will also ask if they're willing to see a nurse. One of the things that we know from research is that folks who access SSP services and work with a nurse are significantly more likely to access primary care subsequently. And that benefits all of us as a community. When our community is healthier, when our community has regular access to medical care, we see a healthier community, we see a reduction in cost to emergency medical. It is beneficial for all of us. Alongside some of the safer use supplies, we also offer some pretty basic hygiene supplies. A lot of the folks that we're serving are folks who don't have regular access to a shower, or they may be moving from place to place. So having things like bathing cloths on hand, having hand sanitizer can be huge. Making sure folks have an opportunity to remove that bacteria and try to avoid transmission of various things that may pass through our community. Like I dropped something, but I'm gonna, oh, so we have some nicotine replacement therapy available currently as well, based on some, I believe, short-term funding, but that has been really valuable to folks who aren't super interested in continuing their nicotine use, but don't have a lot of comfort in traditional medical services at this point due to stigmatizing experiences. It's nice to be able to help folks get just one step closer to that quality of life that they're targeting without the barriers that are inherent to some of the other systems that are available. Sunscreen is harm reduction. Not substance focused, but it's harm reduction, right? It improves quality of life and health and safety. In the substance use realm, we also offer booty bumping kits currently, or boofing kits, that are a useful alternative for folks who might otherwise use syringes, who would like to cease using syringes. And these were created for us initially by a person who had used that method to cease using syringes entirely. So they're a nice thing to have on hand. We also offer more basic hygiene stuff like toothbrushes. Oral health is really important. There are some pretty significant impacts to oral health from substance use. Menstrual supplies, we have tampons and pads and some of the other basics. So often when I talk to people about working at a syringe exchange or at the needle exchange, folks cringe, shrink, flinch, have a hard time sort of with the idea of being around pokey objects all the time that may or may not have things on them that you might not want to interact with, right? Blood, whatever. Most of the work that we're doing in the SSP is connecting with people. It's talking to folks. Folks may come in for a packet of sunscreen and a conversation, and they may or may not pick up supplies for safer use that day. A lot of what we're doing is about that connection and having the opportunity to be in a non-judgmental space and exist comfortably. Do we have questions on supplies pieces before I move forward? Okay. Oh, I see you, Justin, but I can't hear you.
That's because I was muted. Thank you. I had a question. Are there any supplies that like you wish you could have that aren't currently available for you in your work?
I have a massive wish list. There are all sorts of things that I wish that I could have. Currently, we are offering pet strips intermittently due to them being hard to supply. Test strips and microscopes to appropriately measure substances and dilute properly. Test strips, these strips are designed for urinalysis, but can be used off-label for testing substances to determine what's in them, so folks can avoid using a substance that they do not want to use. Folks come in often talking about concerns about what is in the drug supply, and I think that probably my perspective on that is a little biased as I am the drug checking technician, so that's a thing that they talk to me about a lot, but test strips are in really high demand. We have a pretty solid complement of hygiene supplies right now, but we always need more hygiene supplies, more in different types. We often have folks coming in looking for very basic needs. Clothing, socks are a huge request. Keeping your feet dry and clean when, especially if you're living outdoors, especially if you have surface level wounds that you're trying to maintain or keep clean, is really important, and that's a really difficult thing for us to facilitate. Our nurses have gotten really creative at different points trying to help people manage those things. We are very lucky in that our syringe exchange program has walk-in wound care available with nursing staff, whereas many SSPs are operating in very limited environments. They may be operating out of a van or doing home deliveries via bike or showing up at a neighborhood once a week for a couple of hours and operating an SSP off of a table, right? We are well situated and well resourced in that way. Food is also a frequent request. So we operate a very small food pantry in partnership with the local larger food pantry and are able to provide some food supplies on a fairly regular basis. And that is a huge deal that folks might not otherwise associate with SSPs. But if you have one, especially in a rural area, if you have one food pantry in town and you have socially burnt your bridges in that space, or that's all the way across town from you, you have a wound on your foot, you don't have access to a vehicle, and you have to determine, does my hunger matter today more, or does my physical pain matter more? That's not a decision folks should have to make. If I can have a jar of peanut butter and that can change that for a person, my whole day was worthwhile. Cool, we're here.
Awesome, and I appreciate that. We have a couple questions from participants here. What are you seeing in the trends of which supplies are requested more or less currently?
So that changes kind of all the time. There's definitely been a decrease to some extent in syringe requests. over the last year and a half or so, and an increase in requests for smoking supplies. So smoking supplies were not a supply that we carried for a long time, and they became something that, due to demand, we needed to have, and we've been able to integrate lots of folks who were not previously engaged in syringe services programs or peripheral services connected to that SSP due to having smoking supplies on hand. So I would say glass is probably the big shift there. Everything else fluctuates pretty consistently depending on the season and the location. We operate syringe services programs in 3 different locations, one of which is more rural than Walla Walla, and one of which is more suburban than Walla Walla. And the differences in supply requests between all 3 sites is pretty significant.
We have one more. Where in the community, well, I think the communities that you serve, do you refer folks who can't, don't, or won't access an SSP, but still want those supplies?
So folks can purchase some of these supplies out in the world on their own. But stigma from retailers for folks attempting to purchase syringes is one of the driving factors for folks to show up at programs like ours. So that's something that they may run into. All of these supplies can be sourced from different locations. Test strips are really hard to purchase if you are not a harm reduction program or a medical provider. The majority of the time when folks are unwilling to come into the syringe service program, somebody else is doing secondary exchange for them. No, I'm going to correct that in real time. The majority of the time I'm aware of somebody who is unable or unwilling to come in, it's because somebody is coming in to do secondary exchange for them. So we have several folks who come in from more rural areas, quite a ways out, who are offering to pick up supplies for other folks and bring in their used syringes to dispose of them properly. And that's one of the bigger examples currently of that thread of community sticking throughout the history of harm reduction. Folks taking care of one another is what this is about, even as we have expanded into international technical guides and fairly medicalized settings in some cases. That has happened because folks continue to do that one-to-one care for one another.
So I have one more, but I can hold it till the end if you're concerned about time at all, or do you want me to ask now?
Go for it.
Okay. Do you receive, like, especially I think being in kind of some more rural areas, do you receive pushback from community members about any of the specific harm reduction supplies that you offer to people?
Yeah, folks are uncomfortable talking about needles. Folks are uncomfortable talking about drugs. Folks are uncomfortable with the idea of more of any of those things existing in their space. But studies have shown that syringe services programs reduce syringe litter in an area. Studies have shown that there is not an increasing impact on the crime rate in an area when there's a syringe services program present. Often when folks come in and folks further up the admin chain from me have a completely different experience, right? So they're addressing this on a broader level, on a more macro level more often. But from my experience, when community members come in to express discomfort, anger, whatever about the work that we're doing, there is something under that. And if you sit with a person, all of those folks get the same treatment when they walk in, right? If you sit with a person non-judgmentally, you don't try to coerce them, change their behavior, redirect them in a disruptive kind of way, they'll tell you what they're scared about. They'll tell you what that fear point is or what their concern is, or they'll share a really personal story about somebody they love that they lost, that they fear losing, whatever that driving factor is. And from there, you can build relationship. Once you hit that point, it's much simpler to explain the utility of all of these different supplies and how they make our community safer, healthier, a better place to be.
Thank you.
Of course. Oop, I went the wrong way again. Sorry, friends. So benefits of distribution, we're offering information on safer drug use. We're offering information on safer injection. The syringe service program is free. Folks can dispose of their syringes here from substance use free. We have the safer smoking supplies available. There's duplication in these bullet points. Sorry, friends. Overdose prevention and reversal is something that we talk about on a daily basis, both with community members who are not using substances or would not talk about using substances, and folks who are actively using that naloxone for reversals regularly. We have the opportunity to offer cool, innovative programming like community drug checking because we have this relationship built with the community around the SSP that is fairly unique within the service continuum here. And medical waste disposal, I think we talked about a little bit with that injection supply disposal, the biohazardous waste thing. Other benefits include co-located services. We're able to offer at our location currently, we're able to offer medications for opioid use disorder. We're able to connect people almost immediately with that low barrier buprenorphine program because it's in the same space. I can ask for basic wound care from a nurse in the moment when somebody is in the SSP showing me their wound and we're talking about what supplies might help them. I can ask, hey, would you mind if somebody looked at that and helped you out with that? Sometimes that means that they get an oral antibiotic prescription from our prescriber who also happens to be in the building. We offer vaccinations out of this space because we have that clinical team. We talked about having basic food needs covered here. We do finger poke testing for HIV and hepatitis C on a walk-in basis, low barrier for folks. That's free. We are expanding into offering other STI testing as well. If a nurse is available, you only need a phlebotomist for a finger poke, but you need a nurse for everything else. And having the sexual and reproductive health supplies is a really useful way to start a conversation with folks about reducing harm in their day-to-day when they might not be ready to even consider talking about substances to a person out loud out in the community. So key takeaways, harm reduction comes from community for community. Harm reduction directly benefits the health of the whole community. It's a decades-old approach, and each supply we provide has a purpose. There's nothing here that I cannot explain or justify as far as its utility, and that helps a lot when we have community pushback about different things. I looked at some of the statistics today, and syringe services programs are linked to a 50% reduction in HIV and hepatitis C incidence, and that increases over 66% if they're also offering medications for opioid use disorder. We're one of the only places you can have a conversation about overdose prevention that extends beyond, well, just don't use drugs, right? New users of the syringe services program are 5 times more likely to enter substance use treatment and 3 times more likely to cease drug use than folks elsewhere, which can feel paradoxical to folks. That's not why we're doing the work necessarily, right? We have that sort of overall harm reduction, quality of life orientation, but these are some of the benefits that folks have identified from that work that we're doing. And we love questions. So if y'all have more of those, I would love to answer them. Maybe I should check the chat. I don't know what's going on in there.
We've been chipping away at some of the Q&A.
Oh, cool.
So I can ask a couple questions. I think we have a few more minutes. And of course, we invite people to continue to ask away as we're speaking here. So you've been doing this for a while. I was kind of wondering what changes, like what significant changes you've seen, like from from when you first started to now, and maybe you can even move into what you hope to see in the future.
Um, well, so I obviously have not been doing this since 1985. I don't know if that's obvious, actually. I'm older now, but uh, I've not been here that long, nor have I been alive that long, but I have across my lifetime experienced the benefits of a shifting culture around HIV, bloodborne pathogens, those things. And every day that I'm in this space, that is more and more evident in the benefits that I can see people experiencing from that shifted cultural conversation. And that shift that is super evident to me now probably wasn't on a day-to-day basis easy to see for the folks doing that work. And so that's something that I keep in mind all the time, especially as I'm bringing new volunteers or interns into that syringe services space. We may not get to see the destigmatization of substance use in my lifetime, but I'm going to keep working at it and hope we do. We're still going to have these conversations every day. We're still going to train folks one at a time. Treat the human in front of you like a human, right? Be a human with that person. How can we collaboratively improve our community and bring the syringe services program participants into that process as opposed to saviorism? Got a little off track on that question, I think.
You did great.
Okay.
Another one. So you mentioned like working with volunteers and interns. So I was wondering, like, I wrote it down to make sure I don't botch it. But what advice would you have for other people working in harm reduction that you wish you would have known when you first started this work?
I think one of the things that comes up often when folks are newer to this flavor of social support and community building is don't take everything on yourself. There's no sustainable way to continue to be a collaborative, productive, engaged community member when you are trying to solely be responsible for whatever is in front of you. We are all in this together and we have to address it as such in order to successfully shift culture. We can't shift culture as a single human. You have to be able to rely on a really great team, which we are lucky to have here. Don't hesitate to ask questions. Don't hesitate to reach out to other syringe services programs in different places to see what they're doing and see if what you're doing aligns or doesn't and why. And some of that is going to be regional difference and some of that is going to be you just had no idea that you could do it that way, or they hadn't seen the cool supply that you were able to source from this random corner of the internet. And be open to learning from the folks you're serving because that's part of that collaborative process. And it will get you so much further in building relationship, but it also is going to teach you some really interesting stuff that you would not have an opportunity to learn elsewhere.
Awesome. I'm not seeing any more questions, so thank you so much,
Cool.
Malia. We really do appreciate you giving us your time and expertise and talking about this important work you're doing. Like I'm moved personally by harm reduction work, and I think it's really great that you're working on this in the areas that you are. For our participants, we do have the survey up. in the chat now, so feel free to fill that out if you want to get credit for the session. You're getting a lot of thank yous in the chat. Thank you for all you do. Thank you for
Thanks,
bringing your
friends.
whole heart to this work, that kind of thing. So there you go. Additionally, we'll be having a networking session over lunch today. We'll start right around noon, and we'll be looking at kind of breakout rooms based on like rural, urban, and kind of in between places to give you all a chance to talk about the work you're doing together based on the populations you serve. So we're really excited about that. We hope to see you there. The link's in your Eventbrite. So we hope to see you there. Thank you so much. And thank you again, Malia.
Of course. Thanks for having me.